Hi, my name is John Mark. I'm one of the pediatric pulmonary physicians here at Packard Children's Hospital. I'm also the medical director for complex care. The reason that you're asking you to watch this video is because you're taking care of a complex care patient and their family, which means they're part of also this program that we have to help better coordinate care and give them better overall communication with all their healthcare providers, including the primary care physicians and community support. Hopefully what you'll get out of this video is the basic concepts about what we're trying to do, why we're trying to do it, and how you can become involved. So hopefully you'll find this video very informative, short, succinct, and helpful. Thank you very much.
Great. As Dr. Mark alluded to, there will be 4 sections of this video. First, we will familiarize you with the levels of engagement. Second, you'll learn how to use status chats in communicating with your fellow healthcare team members. Third, you'll learn how to use the PACT Clinical Document Inserter as a dynamic care tool. And last, we will cover the patient form that you'll fill out at the conclusion of this video. So, we'll start with levels of engagement. Patient care teams in the complex care program have a special structure, and that structure comes from the levels of engagement. As a provider, your level of engagement is simply your level of involvement in a given patient's care. For every patient, you can be at one of 2 levels of engagement. You can be core, which is more involved, or you can be an advisor, which is less involved, but still an important role. As you can imagine, your level of engagement may shift with changes in the patient's status. We'll get into the exact definitions of core and advisor in just a moment. But first, we'd like to emphasize the function of the levels of engagement, which is to provide a team structure, both for the care team, so that every provider is on the same page about who's directing care at any given time, and for the families to know who are the important players in their patient's care. One way families will see this structure is through the PACT Spotlight card, which lists every healthcare team member on their team, as well as their level of engagement. We'll have you choose your level of engagement in an online form that we send out right after this video, and so to help you do that, we're going to quickly define core and advisor. Core team members are actively seeing and following up on a patient and are actively involved in managing a patient's care. Advisors, on the other hand, have less frequent contact with the patient. They may have played an important role in the patient's prior stage of care, but are no longer core, or may advise on key decisions in their level of expertise. Since complex chronic patients' conditions are so dynamic, there needs to be a way for you and others to shift their level of engagement as the patient's status changes. You can do this, and much more, with status chats, which is the subject of the next section. Status chats are a tool for team communication in moments of activity anytime there's a transition or changes in patient care. Status chats are sent via secure email and are easiest to understand through example. We'll look at an actual example that was sent out by the nephrology team at Packard. As you read over this example, you'll see the key attributes of a status chat. It is a communication letting the care team know how the levels of engagement will shift surrounding a patient's renal transplant. You'll see that the patient's entire care team has been included. And you'll see that the email was titled with a very specific structure. So we just looked at one example of a status chat where the nephrology team wanted to update the levels of engagement. Generally speaking, you'll send out a status chat for the following situations: for an admission, discharge ED presentation, a medical or psychosocial update about the patient, a new diagnosis, or a shift in the way the patient's care team is structured. In the final section of this Status Chats tutorial, we will go over how you can send a status chat. To send a status chat, you will always follow the same 3 steps. First, you'll find the seed status chat email that was sent to your patient's entire care team. If you search your inbox with the ISP number and the term status chat template, you should be able to find this message. You'll notice that everyone on your patient's care team is already included on the recipients list. The second step is to simply reply all with your message to the team. The third and final step is to specify the type of status chat that you're sending out. There are 2 categories of information, and both go in the subject heading of the email. The first is the category of status chat, whether it's medical, psychosocial, based on a change in team structure, or any of the other types of status chats. The second important piece of information to include in the title of your status chat is whether it is FYI or action required. And with that, you're prepared to send a status chat. Oftentimes, status chats contain important information that also needs to be captured in a single electronic record. For this, the Complex Care program has created the PACT clinical document in Cerner, which is the subject of the next section of this video. The PACT clinical document. We'll explore how and when your team will use this EMR tool, but first we'll quickly define the PACT. The PACT is a single dynamic document that any Packard team member can contribute to. It is a clinical document in Cerner, and it contains a summary of important information about a patient and his or her care team. The Complex Care PACT is located in the Clinical Docs tab of Cerner in the folder Other Docs. However, the easier way to access the PACT is from the patient summary page. Here, on the bottom left, you will see a red flag for Complex Care program patients. If you click on the Complex Care PACT link, you will be brought to the PACT document. Once you find the PACT, which, as we said, anyone can update, you'll find the information organized into different sections. There's a section for top things to know about the patient, a section for shared goals progress, a section for the care team, we call this the care core, which has their contact information and levels of engagement, and a section specifying the contact directions outlined for the family. There's also space for additional free text if there's anything else important that you would want the care team to know about in this shared document. So this begs the question, when should you update the PACT? Well, any time that you find pertinent information about a patient that you feel like the entire care team would benefit from, especially if it fits into these 4 sections, is a time that you should update the PACT. In addition, any time that you send a status chat, you should know to update this patient's PACT, since presumably that status chat has important information that you want to share with the team. The final thing that we will cover in this video, then, is simply how in Cerner you will go about updating the PACT. The general principle for updating the PACT is that you'll create a new instance of the PACT ClinDoc that will have pulled forward all of the information from the prior ClinDoc for you to then edit, add, and contribute to. Then, when your fellow care team members go to view the PACT, they'll see this most recent version with your updates included. Before you can create a PACT ClinDoc note for your patient, however, you must first add the document as a favorite in your templates. To do this, simply go to the Documents drop-down menu at the top of the screen and select Options. This will bring up a list of all of the possible clinical document types that you can add to your favorites. Navigate to the Complex Care PACT ClinDoc and add it to your favorites by moving it from the box on the left to the box on the right. Now, you should be set up to update the Complex Care PACT ClinDoc in the same way you would typically create a note. Simply create a new note, and then select the Complex Care PACT ClinDoc note option from the drop-down menu. It should be an option now that you added it as a favorite. When you select it, the most recent version of the PACT will pull forward for you to work with. Once you sign the document, the updated PACT will be available in Cerner for all of your care team members to use. This concludes this video on the tools and concepts of the Complex Care program. Thanks for watching, and be sure to fill out the Future Designed by Me survey for your patient.